Welcome to the Horizon Inspire TMS therapy system demonstration, brought to you by Magstim. Magstim TMS therapy is a non-invasive, effective treatment for mental health disorders. Patient preparation. To switch on the system, press the mainframe on button followed by the monitor on button. Enter your login credentials and press Sign In. Have the patient sit upright in the chair with their right arm resting on the armrest, palm facing up. Ensure the patient is comfortable and their arm is relaxed. Locating CZ. Place the correct size TMS cap on the patient's head, making sure their ears are visible and properly aligned with the ear holes in the cap. Align the midline marker of the cap with the center line of the patient's head by measuring the midline from the pre-auricular points. For consistent positioning, measure the distance between the nasien and the cap edge and record this measurement for use in subsequent treatments. Measure from the nasien to the inion across the midline marker of the cap and make a mark at the halfway point. Label this as CZ. Locating C3. Measure from the left to the right pre-auricular points, passing the tape measure over the CZ mark. Divide this measurement by 5 to obtain 20%. From CZ, measure this 20% towards the left pre-auricular point and label this spot as C3. Motor sensitivity. Select the patient's record on the user interface. Select New RMT Determination and confirm the patient's date of birth. Confirm the stimulator output intensity as 50%. Take the Horizon MT coil from the coil holder and position the coil so that the center recess sits on your C3 mark. The coil should be at a 45-degree angle to the midline marker and placed tangential to the curve of the head with the center on C3. Hold both multifunction buttons to deliver a pulse at C3. Watch the patient's right thumb for a twitch. Note that C3 is an approximate starting location. If a clean response is not found at this spot, gradually move the coil around this spot to find a response. Once a clean response is located, use this spot as your starting location. If a response is not located, see the operating manual for more information. Using the coil up and down buttons to adjust the power, follow the first flowchart in the operating manual to determine the optimum power for locating the motor hotspot. Defining the motor hotspot. With the optimum power found for C3, move the coil 1 centimeter towards CZ and deliver a pulse. Make a note if the twitch was larger than at C3. Now, move the coil 1 centimeter left and make a note if this is the largest twitch yet. Continue to move and pulse in this grid-like pattern for at least 9 points. Mark the point of the largest twitch as the hotspot. Defining the motor threshold. Place the Horizon MT coil on your defined hotspot at a 45-degree angle to the midline, ensuring the coil is placed tangential to the curve of the head. Using the previously defined power level, deliver up to 10 pulses, watching if at least 5 out of the 10 produce a twitch. Follow the second flowchart in the operating manual using the coil up and down buttons to adjust the power. The power level defined by the flowchart should be noted as the patient's motor threshold level. Press the red stop button to disarm the coil. Select the desired pulse on screen and press Register. Press Save and Close to save the patient's motor threshold level to their patient profile. Delivering treatment. On the patient record, select Run Treatment and confirm the patient's date of birth. Note: a treatment plan must be assigned to the patient before run treatment is available. Disconnect the Horizon MT coil by opening the 2 locking levers and removing the coil connector. Firmly insert the Horizon AFC coil connector and secure the 2 locking levers. From your defined hotspot, measure 5.5 centimeters toward the front of the head, parallel to the midline marker. Mark this spot as the treatment location. Using the remote control, adjust the treatment chair to a comfortable height for the TMS administrator and recline the chair so that the patient is comfortable. Adjust the chair headrest and ensure the patient's head is secure and comfortable. Adjust the head side pad so that it rests against the side of the patient's head. Holding the coil with one hand, loosen the central locking knob to position the Horizon AFC coil for treatment. If required, adjust the height of the articulated arm by loosening the lever of the coil arm clamp. Retighten the lever to secure the arm. Locate the recess on the underside of the coil and place it on your located treatment site. Adjust the angle so that the coil is at a 45-degree angle to the midline of the head, tangential to the curve of the head. Tighten the central locking knob to secure the coil and check that the coil is correctly placed. Check the treatment parameters in the treatment summary. Edit the treatment before delivery if required. Press the amber arm button to ready the system and press the green trigger button to begin the treatment. The coil must remain in contact with the treatment site throughout the treatment. Adjusting the power level. The power level can be adjusted before or during treatment by selecting the percentage RMT window and using the scroll wheel. Press the blue check button to confirm the power level change. To pause the treatment, press the red stop button. Do not leave this screen when the treatment is paused. If necessary, adjust the coil. Coil positions should always be rechecked before resuming treatment. When you are ready, press the amber arm button to ready the system. Confirm you want to resume, then press the green trigger button to resume the treatment. Treatment review. A summary of the treatment delivered will be shown, indicating any power level changes or pauses within the treatment. The schedule will inform of any further treatments and actions to be performed in the session. Now is the time to book your free virtual demonstration and learn more about TMS. Visit Magstim.com.